It's 2 p.m. and the umpteenth baby of the day is on the way. Staff at the Mae Tao Clinic in northern Thailand near the Myanmar border get little rest. 28-year-old Mo Win risked everything crossing from Myanmar to reach the clinic to give birth. Like thousands of other ethnic minorities, she and her husband Tae Zien couldn't afford hospital care in Myanmar. The birth brings relief, but the girl's parents will never forget their long journey to get here, even crossing a river by inner tube to cut time. Newborns are poked and protected from scores of diseases. Babies at the Mae Tao Clinic have a much better chance of surviving than those born in Myanmar, where 1 in 10 die in childbirth. When the clinic opened its doors in 1988, it was housed in an old barn. Its founder, Dr. Cynthia Mong, a Myanmar refugee, was treating hundreds fleeing a military crackdown on democracy activists that claimed 3,000 lives. Today, the clinic is a village. Its 5 doctors and 120 medical staff care for 150,000 Myanmar refugees every year. Aside from the maternity ward, the clinic has a pediatric unit, laboratory, blood bank, eye care facility, and space for 100 patients. The clinic receives $2 to $3 million a year from governments, private donors, and NGOs. But the global economic crisis has shrunk funding. Although the clinic has 10 to 20% more cases every year, it is yet to turn anyone away. When the Myanmar army drove her family off their land, this woman who asked to remain anonymous escaped to the Mae Tao Clinic to have her baby. Doctors discovered her daughter has leukemia and they're doing what they can to treat her. Australian Nikki Wongdu is one of 3 Western doctors at the clinic.
Does he have pain?
No, okay.
Wow, his liver is big, isn't it?
The boy has thalassemia, a genetic blood disorder that exhausts him and leaves his belly swollen. He has regular blood transfusions, but he's still at risk of possible heart failure.
So we're going to keep transfusing another unit tomorrow, try to get up to hemoglobin 7 and then DC. When you're seeing patients one-on-one, you do as much as you can, and if you're always busy, you can never finish all of the work that you want to in one day, but if you become too overwhelmed, then I think you're probably not as effective as you could be. So you've got to just accept that there's probably a greater demand than what you can necessarily fulfill.
Many of the clinic's medics are also refugees from Myanmar. Thai authorities allow them to stay inside the clinic, but like most patients, if they step outdoors, they can easily be arrested and deported. Some of the sickest patients are sent to better equipped Thai hospitals. Under a national health scheme, Thais pay less than $1 for health care. Myanmar refugees have to pay the full cost of treatment, although some nonprofits offer to help with the bills. 2 hours drive from the clinic, dozens of orphans are building their future homes in a refugee camp. They're some of thousands of minority Karen forced to flee a recent military assault by Myanmar forces in their homeland. Weeks ago, Gigi stepped on a landmine in Myanmar's Karen state. Desperate for care, he crossed into Thailand. In efforts to reach more refugees like Gigi, the clinic has trained a team of backpack medics. They go to nearby refugee camps, but also venture into the Myanmar jungle, carrying medicine to treat injured villagers fleeing the conflict. Without proper care, Gigi's wound could have gotten even more infected and led to more complications. Now he says he can start planning for the future. He says he hopes to find an aid agency that will help him get a new leg. Karen women who fled Myanmar and now live at the refugee camp have lost nearly everything. Weaving is a remnant from their former lives. Until they can return home, they'll keep the tradition going. But the refugees' lives are tough and their future is uncertain. After more than 20 years heading the clinic, its founder, Dr. Cynthia Mong, sees no end to her work. She says the clinic must keep running as long as the army controls Myanmar.
It is urgently needed to take responsibility to protect further damage. It's not only the responsibility of the Burmese people, I think the people all over the world, responsibility to protect the human dignity and to promote human rights in Burma.
For thousands caught in the midst of the conflict, the Mae Tao Clinic and its staff bring an amount of relief that's hard to measure.